Welcome to our deep dive into Soleal Sling syndrome, a rare but significant cause of lower extremity neuropathy. This condition is often overlooked, yet it can lead to chronic pain and functional impairment if not recognized early. Today we'll explore what Soleal Sling syndrome is, why it matters, and how it affects the tibial nerve in the leg. By understanding the basics, you'll be better equipped to recognize its symptoms and appreciate the importance of timely diagnosis and treatment. Let's start by looking at the anatomy involved and the key features that set this syndrome apart from other nerve compression disorders. Soleal Sling syndrome occurs when the proximal tibial nerve is compressed under the fibromuscular arch of the soleus muscle, also known as the soleal sling. This anatomical structure is located in the upper part of the calf and plays a crucial role in leg movement. When the nerve is compressed, it disrupts normal nerve function, leading to symptoms like numbness, tingling, and pain in the lower leg and foot. Understanding this unique anatomical relationship is essential for grasping why the syndrome can be so challenging to diagnose and treat. Next, we'll discuss the clinical presentation and what patients typically experience. Patients with Soleal Sling syndrome often report a combination of symptoms that can be mistaken for other conditions. Common complaints include numbness or tingling in the sole of the foot, persistent calf pain, and tenderness over the upper calf area. In chronic cases, weakness in the toe flexors may develop, making walking or standing difficult. These symptoms can be subtle at first, gradually worsening over time. Recognizing this pattern is vital for clinicians, as early intervention can prevent long-term nerve damage. Now let's move on to how this syndrome is diagnosed in clinical practice. Diagnosis of Soleal Sling syndrome relies heavily on a thorough history and physical examination. Doctors look for signs such as localized tenderness and neurosensory changes in the foot. Radiological imaging like MRI can help rule out other causes of tibial nerve compression, but these tests are not always definitive for idiopathic cases. Electrophysiological studies may also be used to assess nerve function. Ultimately, a combination of clinical suspicion and targeted tests leads to diagnosis. Next, we'll explore the various imaging techniques and their roles in confirming the syndrome. Imaging plays a supportive role in diagnosing Soleal Sling syndrome. MRI and other radiological tools can help exclude secondary causes of tibial nerve compression, such as cysts or tumors. However, these modalities often lack consistency when it comes to identifying idiopathic cases of the syndrome. It's important for clinicians to consider other conditions that mimic the symptoms, like tarsal tunnel syndrome or chronic exertional compartment syndrome. A careful differential diagnosis ensures that patients receive the most appropriate treatment. Now, let's look at the treatment options available for this condition. Before considering surgery, some patients may benefit from conservative treatments. These can include physical therapy, neural mobilization exercises, and pain management strategies. While evidence for the effectiveness of these approaches in Soleal Sling syndrome is limited, they may provide symptom relief for mild cases or those unable to undergo surgery. It's important to monitor progress closely, as persistent symptoms may indicate the need for more definitive intervention. Next, we'll discuss when and how surgical treatment is considered the gold standard. In most cases of Soleal Sling syndrome, surgical decompression of the tibial nerve is the definitive treatment. Surgeons may use a medial or posterior approach to access and release the nerve from under the soleal sling. This procedure aims to relieve pressure, restore nerve function, and alleviate symptoms. Surgical outcomes are generally favorable, especially when performed before permanent nerve damage occurs. Postoperative rehabilitation is crucial for optimal recovery. Let's now review the prognosis and long-term outlook for patients following treatment. Prognosis for Soleal Sling syndrome largely depends on the duration and severity of nerve compression before treatment. Early intervention typically leads to significant symptom relief and functional improvement. However, delayed diagnosis or prolonged compression can result in permanent nerve damage and persistent symptoms. Regular follow-up is essential to monitor recovery and address any ongoing issues. Rehabilitation, including physical therapy, can help restore strength and mobility. In our final scene, we'll summarize the key takeaways and highlight the importance of awareness for this rare syndrome. In summary, Soleal Sling syndrome is a rare but important cause of lower leg neuropathy. It results from compression of the tibial nerve under the soleus muscle, leading to pain, numbness, and sometimes weakness. Diagnosis relies on clinical evaluation and targeted imaging, while surgical decompression remains the gold standard for treatment. Early recognition and intervention are crucial for optimal outcomes. By raising awareness among clinicians and patients, we can improve diagnosis rates and help more people achieve relief from this challenging condition. Thank you for joining us in exploring Soleal Sling syndrome.